Good afternoon, North Dakota. Thank you for joining us. And Jacob, have you been doing the lead for the last 15 minutes? Thanks for keeping everybody entertained. Appreciate that. We have so many things in North Dakota for which to be grateful. And of course, as we head back with students heading back to school, many families celebrating that time-honored tradition of the first day of school as our universities get back to teaching classes on premise. As we progress through harvest across our beautiful state, we're reminded about all the wonderful things that we have here going on in North Dakota. And of course, it's been lots of things happening too at the local, state, and federal level beyond COVID, whether it's visits by the U.S. Secretary of Energy this week or the U.S. Undersecretary of Agriculture, but we'll keep our briefing today focused on COVID, but would want North Dakotans to know that there's lots of things happening in our state that are very positive outside of COVID, and make sure you're checking all your other news sources for those. But we are grateful for all of you joining us today. We know we've got many folks that make a regular investment in their own time to make sure that they can help themselves, their families, their neighbors, their communities, and their organizations to move forward with facts, not with fear, and we appreciate that. We especially know that as we head into this holiday weekend, that many are of course, hoping to make the most of one of the last weekends of summer, so to speak. And as you and your family enjoy the holiday weekend, again, we want to right off the bat just encourage people to continue to be North Dakota smart to help us avoid. We did see spikes around the nation and some in North Dakota following holiday weekends when we gather in larger groups and gather in those large groups in close proximity without social distancing, without masks. We can see cases that follow, and we do that because, or we see the cases go up because, of course, this is a part of the challenge of COVID. When they call it an invisible disease, it's actually sometimes invisible to the people that are spreading it because of the asymptomatic. Last week we shared data that said of all the positive cases in North Dakota, over 50% of those, 56% I think was the number we had last week, going through all the cases that were asymptomatic or pre-symptomatic at the time that they tested positive. Pre-symptomatic means they may have developed some symptoms after the time of their test. But to avoid the spikes we saw on Memorial Day and 4th of July, because we want to make sure that we're being careful and practicing North Dakota SMART guidelines. And one other thing that we did also want to talk about, because since many of our universities have kicked off, we've done a lot of university testing already, thanks to those university leaders that are helping to drive that charge and those student leaders that are involved in that. But as Dr. Birx from the White House was here last week, she spoke about the importance of students staying on campus and minimizing unnecessary travel. And we do know that we have a lot of cases that are in our university communities and among university students. And so and we know the virus can travel quickly when students travel from community to another. Young people are, in fact, more likely to be asymptomatic. And of course, and at that age, perhaps more likely to engage in social settings where the transmission could occur. So for this reason, a number of our university leaders and our North Dakota university system statewide are encouraging college students to stay on campus or in their campus communities and to make use of available COVID-19 testing. And again, I'm sure some people might say, well, who would want to stay on campus over a holiday weekend? Well, there's plenty of reasons this year. A few of those examples, in addition to getting to know your university better, whatever. Some of the Mayville State students can participate this weekend in a 3-point hoops tournament. They can view a special screening of Black Panther, go for an open swim at the Mayville State pool. That would be where all the kids from Arthur learn to swim. So thank you, Mayville State, for that. Dickinson State University, their President Easton. Welcome, President Easton. Great to have you here. Complete with yard games. Students are invited to a backyard dinner at the President's House. They'll also have an opportunity to attend the Medora Musical and the Pitchfork Fondue. That's for Dickinson State students. So again, a number of things going on as students continue to mask up on campus. So thank you for the university leaders for creating that opportunity. And again, as we've seen, whether it's a university campus or whether it's a business, we've learned a lot working through this pandemic, global pandemic, the last 5 months. And business entrepreneurs and innovators are showing us that sometimes the new normal can actually be a better normal. It doesn't have to be a less than the old normal. It can be different and it can be better. So thanks to everybody that are working to create a better new normal. And again, we would also encourage individuals, family, and students that if you've got family gatherings this weekend, to be safe, particularly if they're multi-generational in nature, because of course we know that this disease causes serious illness and even death among people that are elderly and have underlying conditions. So again, college students, if you've got grandparents or loved ones that fit those categories of being more vulnerable, and you've been on campus in our communities where we know that we have a high number of actives, please use extra caution in keeping your distance or wearing a mask when you're around your loved ones. If you're unable to stay on campus, to make sure if you're going home to help with harvest or something like that, make sure that you're being North Dakota smart and protecting those that are around you. One other thing we want to also share at the outset too is in the context, before we get into our own numbers in the state, is always the context of what's going on in the country and regionally. There are, as we saw first, where this really hit the northeastern part of the U.S. really severely. Then it moved to the southeast, then it moved to the southwest. Of course, we're probably all hoping that, as some people might describe the Midwest, expanding kind of from Indiana and Illinois over to North and South Dakota, that somehow the Midwest might be spared. But there are now today putting out, based on the numbers, that there are 7 states in the Midwest that are on the watch list, if you will, for increased rates. And for the first time since the pandemic began, on the 14-day rolling, we've got some of the highest percent positives in the nation are now showing up in the Midwest. South Dakota leading that list with a 14.7, and Iowa at 11.2 on the 14-day rolling percent positive. So we've got COVID, if you will, in the neighborhood, and we've got again, perhaps unfortunately for the Midwest, our turn to have higher prevalence. While we again watched other parts of the country do this earlier. So here's the numbers we're watching in North Dakota, and I think this increase in the Midwest is showing up in the numbers here in North Dakota, with 1,838 new cases this week. That includes 969 we've had newly recovered cases. So again, the majority of people continue to recover, but sadly we had 11 deaths reported over this last week. We are now at 2,437 active cases. That's a slight adjustment from the this morning 11 o'clock reported number, but that's the current number as of today at 3:30, so 2,437, and that is a new high for the state of North Dakota. And again, that's more than double the number of actives from mid-August, and it's more than 500 increase in more than 500 just compared to a week ago. With the last 7-day 1,838 confirmed new positives out of a 36,305 total tests. That brings the last 7-day positive test rate to just over 5%, 5.1% among all the North Dakota tests that were completed. And that's using positive tests as a percentage of total tests, which is the way that the official CDC COVID data tracker calculates percent positivity. And this week's tests included 10,149 North Dakotans who had not been tested at any time prior during the pandemic, and 26,146 tests of here in North Dakota of people who had been tested at least once prior. And again, those high amount of serial testing or repeat testing reflects the great care that we're giving to those that are in our skilled nursing and basic care and assisted living, both the residents and the staff, as well as our medical personnel around the state that are on the front lines of this battle. In total, we've now completed 486,041 tests of North Dakotans, and that includes 205,000 plus unique North Dakotans to result in those number of the 12,629 positive cases. So again, a fantastic job by the state on staying on top of testing. Testing, we talk about this being an invisible enemy, but it's not invisible if we're doing a great job of testing. So thanks to everybody from the National Guard to the state lab and the private sector healthcare that's helping keep North Dakota on the forefront of testing. When we take a look at our statewide positive rate of completed tests, again, this is a rolling 14 days, so you'll see a slight variation from some of the 7-day numbers, including the one that I just reported. The 14-day rolling average has been increasing in recent days. You can see it's on a pretty steady upcline. Today it's at 4.9%. It's a full percentage point higher than a week ago. And that, again, today's cases today was a 5.5% for the daily. So when we're above our rolling average, that continues to pull it up again. We currently have 67 people that are hospitalized. And of those those that are hospitalized, again, we can see this number kind of bouncing around. Earlier in the week, I think we showed a number of 70 on Monday. That's been readjusted because there was some discharges on Monday that weren't included in that number that brought it down. So with this revised number, the 68 number today, well, it still represents only a single-digit percentage of our hospital beds, and only a subset of these are in ICU, so only less than 5% of the ICU beds in the state are dedicated to COVID. It still represents, at least currently, our high watermark so far for hospitalization, but I want to assure people that with our great medical services in North Dakota, the work that we've done has preserved hospital capacity, and with the new therapeutics, whether it's the convalescent plasma or the remdesivir, there are new approaches that our hospitals and providers are applying here in North Dakota, which is again helping drive down the fatality rate nationally. But sadly, even with those improvements, we have had 150 people die with COVID since the beginning of the pandemic, and we've had 11 new individuals who've passed away in the last 7 days. A man in his 50s from Benson County, a woman in her 80s from Burleigh County, a woman in her 90s from Burleigh, a man in his 50s from Grand Forks, a man in their 70s from Morton, a woman in their 80s from Burleigh, a woman in their 90s from Williams, a man in their 70s from Morton, and a woman in their 80s from Burleigh. And then adding to that, those 9, today we report that a woman in her 100s from Williams County, and a man in his 60s from Burleigh County, and each of those 11 individuals also had underlying health conditions, which again, COVID can quickly compromise those underlying health conditions. As always, from the First Lady and myself and Lieutenant Governor Brent Sanford, our hearts go out to those family and friends, all of who have lost loved ones, regardless of age or circumstances. Never, ever easy to lose a spouse, a parent, or a grandparent, and we're thinking of all of those families. When we take a look at active cases around the state, again, we see that there are all but 4 counties. The 4 counties here are in gray on this slide, are the ones that have 0 active cases, but the other 49 have at least 1. Most number of active cases showing up in Grand Forks County, Burleigh, Morton. Together, as we think about the metro area of Bismarck-Mandan, account for 550 active cases here. Other counties with high active case counts include Cass, Stark, Williams, Ward, and Stutzman, with all more than 100 active cases. There has been a lot of focus in the national media lately on North Dakota cases per capita being among the highest per nation, and cases per capita means the number of positives per our population. Rarely when those are reported, maybe rarely is too calm, I'd say never I haven't seen a report yet when they're reporting about that per capita number, do they also include that North Dakota has among the highest testing rate, if not the highest testing rate, when we include our serial testing of long-term care facilities, et cetera. And so let's take a quick look at other states in our region. There are 6 states, Montana and Wyoming, Utah, Colorado, and North and South Dakota that are part of what's called FEMA Region 8. And we've had a lot of activity with FEMA related both to the pandemic and other emergencies. And they track this data at the FEMA level. If you take a look at the data, North Dakota with 503 tests per 10,000 people, when you get this all normalized to a per 10,000 people, that takes, when you do that normalization, it takes away the population differences to give you an accurate compare, because obviously all of these states, with the exception of Wyoming, have more population. So normalizing it to per 10,000, next closest is Utah at 144, Montana at 122, Colorado at 108, South Dakota at 92, Wyoming at 56. So a simple way to think about that is that we're doing anywhere from 3 times in the case of Utah to 10 times in the case of Wyoming as many tests as other regions. So and over half the tests that we're finding are asymptomatic. So we know that we're doing a better job of identifying cases, and when you identify cases and isolate them, that helps slow the spread. But when we're identifying those cases, then that can drive up our per capita number. And so again, as perhaps some might suggest, if you want to improve your per capita positive number, you'd simply do less testing, but that's not the right strategy. It's not right for the people that are at risk in our state, the 20% of our people that are vulnerable, and it's certainly not our strategy here in North Dakota, because we want to apply the best approaches and the best data and save the most number of lives. At the same time, the testing helps us keep our businesses open, because we know who has the COVID, and we know how to combat it. Jumping ahead to the county risk levels, as you recall, when we launched our North Dakota Smart Restart Plan back in April, which was to help provide guidelines. We've learned a lot since then. At the time we developed that, it was developed with input from statewide industry groups, more than 60 members of the business community, North Dakota Department of Health, the Department of Commerce, the Governor's Office, and many industry groups all worked. Again, we were trying to come up with a plan that would allow us to safely reopen with our, at that time, understanding of what we were dealing with. It provided North Dakota businesses and residents with clarity and specifics, including a color-coded health guidance system for economic reactivation, and that's the dial, which I think everyone's got some familiarity with, but it goes from high risk to low risk on a color scale that follows the color spectrum, and that would be red, orange, yellow, green, and blue, or for those that remember that from elementary school, Roy G. Biv, ROY, red, orange, yellow, G for green, and then blue, but we stopped. We did not include indigo and violet in our color scheme. We just took the first 5. But blue is the new normal, and blue is even better than green, and so it's easy to think about green as being the best, but blue is even better. On May 29th, we had the entire state, when we started at the moderate or yellow risk level, we took the whole state to the green level, which is the low risk level. And we had a great summer. We had a low positive test rate. We had high testing per capita. We had plenty of hospital capacity, and we had a great summer. But during that time, of course, there was none of our schools were in operation. And as we said all summer long, that when we started adding back 120,000 plus school kids in congregate setting and 45,000 college students, doing that at the same time, we're trying to maintain and keep all of our businesses open and have visitation at long-term care facilities, that we were adding risk back into our system. We knew that, and we've been able to manage all that risk successfully. But again, as we have seen after earlier this summer, after the 4th of July, we saw cases rise to about 924 active cases at the end of July, and then they held steady about the 1,000 range until about the time that we started our back-to-campus testing in mid-August. Over the next 2 weeks, we added 500 active cases a week, and today alone, we had 360 new cases minus 139 recoveries to get us to that new number of the 2437 of active cases statewide. And Despite that surge in surge for North Dakota in the second half, our robust testing, meant that our test positivity rate remained under 5% on the rolling 14-day. As you see, it's just up underneath that. Staying under 5% on most of the national scales keeps you in the green category. Between 5 and 10 for many, including the White House, puts you in the yellow or risk category, and above 10 is a place where we have never been and don't want to go as a state. But our growth in testing, even if we ramped up the amount of testing, our active cases and positivity rate have gone up even higher. So these increases in actives are not due to increased testing. They're due to the increased positivity rate, which means we do have a higher prevalence. We've taken a statewide approach to our risk levels so far, but last week I signaled fairly strongly, I believe, at this conference that, as we have all along, that we would always reserve the right to start moving away from an entire state to individual counties and apply the risk, our low to moderate risk schedule from green to yellow, based on trends that we saw, depending on where things might be going. And it's important to note, as we've had all along, that 8 of our 53 counties have still had less than 10 or fewer cases in the county since the pandemic began. We've had 12 additional counties that have had 20 or fewer cases in total. I'm not talking about active, I'm talking about since the pandemic began. And currently we got 4 counties that have no active positives, and we have almost 30 counties that have 10 or fewer cases. And so if those cases, 10 or fewer, they know who they are. They've tested positive. They're isolating. Their close contacts are quarantining. The risk of spread is very low, and those are probably as good a places to be in our entire country. The risk is not uniform across our state. What do some of those counties have in common? Well, yes, they're largely rural or very rural in the sense that they've got low population density. They likely maybe have no large metro area, which then would become like a regional as opposed to more local shopping hub. So there's less people coming in and out from outside the community. And in most cases, these communities, particularly the counties that have had such few cases, also do not have any universities, private or public, within their county borders. So again, we also said last week that we were going to take a look at some of the gating criteria, determine if we should be adding some additional metrics into our thinking on top of the ones we had before to help reflect what all of you and all of us particularly have been looking at each week. And if you think about what we've been really focusing on here as some of our main dashboard items, is we've been focusing on the 14-day rolling average of active cases per capita. We've been focusing on the 14-day rolling average of how much testing we're doing. And we've also been focusing on the 14-day rolling average on the % positive rate. And why these 3 things, and why in combination, and how do they balance themselves out? Well, active cases, far more valuable for us to understand than anything related to cumulative. Active tells us the number of people who could be actively spreading it, and that's where we need to have our public health controls and our individual responsibility really working based on the number of active cases. The number of testing, if you've got low active cases but almost no testing, that doesn't really give you a good indicator. And so we want to have high testing with low % positive rate. That would put you in the spot where you would have a great deal of confidence with a high amount of testing and a low positivity rate and a low number of actives that you're there. And on the tests we've talked about too, it's not just about quantity, it's also about the quality of those tests and how fast those turnaround times are also going. So, well, this is not an exhaustive list, and we've got the other criteria that are also very important to us, including hospitalizations and our healthcare capacity, not just beds but people, and our original 11 gating criteria. But we take a look at all of these inputs and take a broader, holistic look at decision making. But again, the active cases, testing levels, and positive rate are 3 things we want to move up on the dashboard. With this approach, today we are implementing for the first time county by county guidance, and we're going to be moving some counties up in risk level, some counties down in risk level, and some will remain the same. If we take a look at the updated guidelines, this is what the state would look like under our current guidelines, which is we've had the statewide approach. Everybody's been in this green or low risk area. But we do have a number of counties, as I described, that have been really escaped this from the beginning. And we're going to pull up those counties here. They're shown in blue. And these counties are spread around the state. Again, they do fit that criteria which I described, which is they are likely to have no very large metro area, no university. They're very rural, and they've got low active case counts, and they've all done either sufficient or highly some of these counties have done a great job on their testing. So they've got, strong testing with low positivity counts, low number of active cases, and unlikely that they're going to be in a high transmission risk. And so these guys are moving down to the what we call the new normal, or the blue. Blue is where we want to get the whole state to, and what's called these are leader counties that are doing that. There's 13 counties that are in this space. But just because you say, hey, I live in a county that is now at the lowest risk level doesn't mean that you should become complacent. There is additional risk in each of these counties. Have K-12 students that are returning to school, which creates more transmissible moments, and we would not want a blue to turn back into a green. And so again, make sure that if you're in one of those counties, well, we can be grateful for the success. You may not even know anyone who's had COVID. That's a great place to be in our country right now. But please continue to exercise the North Dakota SMART guidelines, particularly as it relates to the K-12 schools, because the goal of all of the work we're doing here includes keeping our K-12 schools open and teaching on premise. Getting kids back in school, and when kids themselves have very little health risk that's known today from this, and getting them back into the school setting. There's lots of other health benefits, whether it is mental health, behavioral health, or the health and sanity of other family members that are trying to juggle jobs and schedules and hybrids, et cetera. We want to try to keep moving our state towards having all kids in school every day of the week. That's where we're trying to get to, and there are certainly also some benefits associated with that. There's new information coming out on the hybrid school models, where if kids are in school one day and childcare the next and back to school, and their cohorts are changing, that may be creating more risk than the risk of density of having all the kids in the same school and staying within their cohorts. And again, density risk is dramatically lowered when masking occurs. And so again, we do have even some of our larger school districts that are doing 5 days in-person learning and using a masking strategy to help do risk reduction. And again, we encourage all of K-12 to keep looking at those potential solutions as we work to try to keep everybody in school. Going the other way, we've got updated guidelines on risk levels for 8 counties, and those 8 counties include Barnes, Benson, Burley, Grand Forks, McLean, Morton, Stark, and Williams. These counties account currently for 2/3 approximately of the current active cases. So right now we've got 15% of our counties are representing 2/3 of the cases. So we said all along that we were going to do targeted and proactive activity, and this is what we're doing right now. As we take a look at what are the goals that we want to achieve here, the goal with this action is twofold. We want to decrease transmissible moments, and we want to give the virus less opportunity to spread. Who's in charge of decreasing transmissional moments? Well, it's not the state of North Dakota, it's you as individuals. Only you can either put yourself or take yourself out of situations where transmission could occur. And so again, this is about keeping distance, if you're able to, wearing a mask if you're not able to, and of course, you practicing great hygiene. Part of the reason we're going to the 3 color codes, some blue, the new normal, some low risk green, and some moderate risk, which is in the yellow or orangish color on here, is that we're doing this because we really want to raise awareness and communicate to North Dakotans that an elevated risk level does exist. And there are things that need to happen. If we want to keep our schools open, if we want to keep our businesses open and get them back to operating at 100%, if we want to get back to watching sports live, if we want to get back to going to concerts, there's a lot of things we have to do. And I want to focus again on the students. Our students have given up a lot. Last spring, they missed classes. We canceled spring sports. They missed proms. They missed graduations. Who else has given up a lot? Our residents in our long-term care facilities, lost this spring months of time and personal face-to-face visits with their loved ones. Our goal all along has been to protect the most vulnerable and keep things open. But for us to do that, we require everyone to be in it, in the fight, and be responsible. We truly are in this together. Dr. Brooks was here last Saturday in North Dakota, and during that time frame, she explained in detail during that visit after her traveling to 24 other states, and certainly I didn't need a visit from Dr. Brooks because of the regular contact we've had between governors around the country, and knowing from being in small phone call groups with governors that included Mississippi and Texas and Arizona. Again, from what we learned down in the South, when this went through the South this summer, hospitalizations, which we do look at, hospitalizations are not a leading indicator. They're a lagging indicator. And we know what happens when hospitalizations go up is the deaths go up. And so deaths and hospitalizations are lagging indicators. You cannot drive or steer the ship or drive a car down a windy road by looking out the rear window. So we have to be looking forward. And while we're pleased that in some of these counties, and I'll single out Grand Forks, where a high percentage, we've had as high on some days of over 85% of the cases in Grand Forks County have been people between the ages of 15 and 29. Well, that's great. We're finding cases, college-age students, and isolating them. They've done a great job up there of creating opportunities for them to move out of dorms and into hotels. It helps the hotels with revenue. It helps stop the slow and the spread. Also in Grand Forks County, there's been less than a dozen, sometimes less than 10 people that are over age 60 that have it. That's great. But what happened in the southern states when they had the post-Memorial Day steep increase in cases of 15 to 29-year-olds. A few weeks later, the cases started increasing in older age groups. Older age groups are people that might be working. They might be working in long-term care. Then you ended up with infections going into the most vulnerable, and then we ended up with deaths. Louisiana, which was hard hit right away, coming off all of the activity that was associated with the Mardi Gras, and Arizona, each of those states have had more than 5,000 COVID deaths. And that's 33 times as many deaths as we've had in North Dakota. And you've said, well, hey, they've got more people. Yes, they do. Arizona's got 10 times the population. Louisiana's got 6 times the population. But they've had 33 times the number of deaths. And again, we're trying to be proactive and avoid that situation. But you don't have to go even as far down there. Minnesota, which has 7 times the population of North Dakota, has had 12 times the COVID deaths. So again, we're serious about wanting to protect our loved ones and the most vulnerable, but we're also serious about making sure that we can keep our schools open for in-present, for on-premise, not on-present, on-premise, in-person learning. We want to keep our schools open for that K-12 and higher ed. We think it's the healthy and smart approach to go, and so we're working to do that. So why then today move the risk levels? Why? Well, we're not going to wait until we have a double-digit positivity rate to try to raise awareness, because these are lagging indicators. As we've talked about earlier, when we've now for the first time got the 2 highest % positive states in the nation being nearby Midwestern states, South Dakota and Iowa, then now would be the time for us to be proactive, because we said we're going to be targeted and we're going to be proactive. We're doing both of those things today. Local leaders, again, are encouraged to use these guidelines as a baseline for their own policies. Because remember, the North Dakota Smart Restart are guidelines to help guide local policymakers. And one of the 5 cultural values that we talk a lot about in state government is leadership everywhere. And we've talked about we're gonna need leadership again, whether it's if you're a faith-based organization that saw your Sunday crowd starting to increase in these communities that have high active cases, and everybody was no longer maintaining distance, and people was, hey, I don't need to wear a mask anymore. This would be a time, again, to just help raise awareness. If you're someone who runs an establishment that has a lot of college kids there. Again, what happened in Arizona and Louisiana and Mississippi, and I know those Republican governors did not want to do that, but when they shot up to the 10 to 15% positivity rate, they were back closing bars again. So these guidelines suggest less density for bars and restaurants, but we're keeping them open. So again, this is an opportunity for everyone to be proactive, to keep the businesses open, keep our communities safe. Our long-term care facilities and our K-12 and our universities, some people might say, oh, the university's the problem. All the university students are getting positive. That's driving our rates up. What happens in an institution is a reflection of what happens in the community and vice versa. And so if we've got high testing and high positives on campus, it probably means that that's going to be going on in the community. And so again, we're all in this together. It's not university versus city versus county. It's not state versus city or state versus county. North Dakotans, we are all in this together, and we need to work together. People will ask me, and I'm sure it'll come up again today, they'll say, well, what are you going to do, Governor, because these aren't laws, these aren't mandates, no one has really forced to require this. I would just go back to when I've seen North Dakota at its best. I mean, let's go back to having been a resident and an employer in North Dakota, during the '89 flood, the '97 flood, the 2009 flood. There was no law that said tens of thousands of people had to show up and fill millions of sandbags. There was no law that mandated that people come out and try to help save their community. There was no order that said, thou must fill X number of sandbags. People did it. And nobody said, oh, this is impinging, on our freedoms. They did it because they wanted to save their community. And so there's the same opportunity for us here to reframe this as an opportunity, if you're socially conscious about wanting to help your community or your state. If you care about the loved ones that or maybe you don't have any elderly loved ones, but someone that does, then there's an opportunity here again to step up and help do your part. We're certainly again understand that this comes down to local leadership. We know that we're putting pressure on local leaders and owners, perhaps because they'll say this is short notice, but again, this is just guidelines. These are not mandates. We're asking that these guidelines go in effect at 5 p.m. Tomorrow, Friday, before the Labor Day weekend, because if we can slow the spread over the Labor Day weekend, that will set us up for greater success as we head into the fall and winter, which usually has increasing demand for healthcare services due to the fall flu season, and as we head into winter. We're extremely grateful to our external advisors, our Chief Health Strategist, Dr. Josh Wynn at UND, Dr. Paul Carson at NDSU, the North Dakota State Association of City and County Health Officials, with whom our staff all met with and received input from them on Tuesday. And so again, thankful to all of them. And as I've said multiple times, we're all in this together. So let's mask up, ND, and let's get our numbers moving in the right direction. If we can keep our percent positivity below 5%, we can keep things open and going, and we can make sure that we're protecting all of the businesses in our state that are fighting hard to keep going during this time frame and protect our citizens, and we can keep our schools open for in-person learning. Next topic is Interim State Health Officer. Very pleased to announce today the appointment of a new Interim State Health Officer, Dr. Paul Mariana. Since 2015, Dr. Mariana has served as the Associate Chief of Staff for Education at the Fargo VA Healthcare System, which is part of the U.S. Department of Veteran Affairs. He has also served as a member of the Red River Valley COVID-19 task force, and so was engaged in the great success that we had going on in Cass County with that. So he's been familiar to our team. In addition to that, I want to thank him for his service because, again, about 5 years ago, he became engaged and started working with the enlisted to join the North Dakota Air National Guard. He has recently passed his flight officer, medical flight officer training, and so again, he serves in that capacity for the Happy Hooligans, the famous and acclaimed 119th Airborne Group out of Fargo. And so again, he's got great familiarity, and again, with his work in the National Guard, this is very helpful because the Guard currently with 300 plus guardsmen guardsmen and women that are involved today in helping fight this battle, and so involved in the testing strategies, his work in a healthcare system where he was on the front lines there as the Associate Chief of Staff for Education to work on educating staff and preparing the VA health system in North Dakota to be prepared for this. So he's been on the front lines since March when it happened. He grew up in Argentina as a very young boy, moved to Florida when he was 11. He's attended multiple times school at the University of Miami. He had an undergraduate degree in applied mathematics. He was a resident. He served his residency at the University of North Dakota School of Medicine and Health Sciences, and was at the time it was working at Merit Care in Fargo, and where he served as a chief resident. And again, he's also completed a fellowship in infectious disease at the University of Miami. And prior to the VA, he worked for 3 years as an infectious disease physician at Sanford Health, for 4 years there. So anyway, he's got some fantastic relevant background, whether it's in data analysis, whether it's infectious disease, whether it's with his military service and his work on the COVID-19. We're really pleased to have him step into this interim role, and he'll begin work on September 14th. By law, we need to have the position filled at all times, and so the interim state health officer until Dr. Mariani joins the health department on September 14th. I want to thank our North Dakota Department of Health Chief of Staff, Dirk Wilkie, who is currently serving in the interim for these 14 days until Dr. Mariana arrives. Next topic is executive orders. We have 2 executive orders we're announcing today, and both of these relate to cutting red tape in North Dakota, which I'm pleased to say, which we've been doing with these executive orders since the get-go. These first one is related to dentists, and we have, of course, no dental school in North Dakota, but we're always interested in trying to recruit and attract graduates of dental schools to be licensed in North Dakota, and currently the initial application for license to practice dentistry in North Dakota requires that you complete a patient-based clinical competency exam by performing a periodontal exam on a live person. We're suspending the patient-based requirement, which allows qualified applicants to complete the clinical competency exam on very lifelike dental mannequins instead of a live patient. This is a common practice among dental boards across the country, and as in other practices, if you would see the level and sophistication of the medical mannequins that are used in our nursing practices, for example, this is surely sufficient. A person still has to pass all the requirements to be able to do that, but they're just able to do it on a mannequin instead of live. As a result of COVID-19, testing organizations have significantly limited the administration of live patient exams. Testing organizations are administering clinical competency exams using these dental mannequins. Removing the patient-based requirement allows the dental board to accept clinical competency examinations using the mannequin. The change will allow applicants to still be able to become licensed by demonstrating their competency for licensure and reducing the risk of spread to themselves and the live patient. So that is in effect immediately, and of course with the support of the dental examining boards. The second executive order relates to substitute teachers, which is, we've heard from school leaders around the state when teachers become exposed to someone who had tested positive. Well, they may not have it themselves during that period of time where they're asked to quarantine or self-isolate. We know that we're going to have some challenges. And our K-12 schools have opened for the 2021 year. We know that licensed teachers are central. You can run a school without a few students who may be homesick, but it's impossible to run a school without teachers. And they're the epicenter of learning and central to the whole relationship that we need to build between students and teachers to keep everybody both learning and keep them safe from a whole health standpoint. As the COVID-19 virus continues to spread, staffing challenges are happening across our schools, especially for licensed teachers who may have to quarantine or isolate. This executive order allows for interim substitute teachers to remain in a classroom beyond the current limitation of 10 days. Did not know that till just recently, but if you're a substitute teacher, 10 days is the max that you have in a classroom right now. So eliminating this, again, with the support of all the folks involved in the education fields, this seemed a bit like a no-brainer right now, and we'll continue to work together, working as one with legislators, with boards, with the teachers unions and others to explore additional ways to provide flexibility to address staffing shortages in K-12 due to COVID-19. And next topic is CARE-19 update. As you know, North Dakota continues to offer and support and promote one of the strongest tools in our fight against COVID-19, which is the CARE-19 alert and CARE-19 diary. The CARE-19 alert is the new application which was just announced a few weeks ago, and this is the app that uses Bluetooth proximity technology, which was developed through a highly unusual, first time ever joint collaboration between Apple and Google to create what they called exposure notification, because it unified two major global players, competitors who had different approaches to Bluetooth or near-field technology. It collects random anonymous keys, which are transmitted by phones, and using this technology, and particularly this API or application programmer interface, it can reduce the burden on public health officials by helping you and unlock the ability to quickly understand who you may have been in proximity with. And again, COVID-19 can be transmitted through close proximity to infected individuals. It's critical to notify people quickly if they've been exposed. The exposure notification or alerts that people can receive on their phones to let them know they've been exposed to someone who is diagnosed with COVID-19. And again, you don't have to provide any of your own information. Your phone is being notified because that random ID number is being notified, but nobody in the system knows they're actually notifying you. Contact tracing is an important pillar as we battle COVID-19 in today's highly connected and mobile world where COVID-19 infections are spreading sometimes at an alarming pace. Contact tracing requires efficient, effective use of both technology and the physical processes to investigate the contact history of individuals who test positive. And I would just take a note on this again, when the U.S. gets compared to other countries on contact tracing, this really varies by country and by culture. And in some countries understand that when they get contacted by a contact tracer, that they would say to that contact tracer, thank you, you're reaching out to me because I may have been exposed. And they may want to know who might also have been exposed so you could help them. In countries, culturally, some people, lean into wanting to participate, to share information, to help protect the health of their neighbors and loved ones, or even strangers that they may have been in contact with. Here, we're finding it a little different in the U.S. and particularly in North Dakota. We know that we have traced back outbreaks to weddings. We've traced outbreaks back to funerals. We've traced outbreaks back to particular gatherings. And then when people leave that wedding, and then they go back to work, then they infect businesses, then they infect their family, and away they go. We've had cases in North Dakota where when people find out that we've got a people were infected at a wedding, and then they say, well, who else were you sitting by at the wedding? And then people say, well, I'm not going to share that. They're trying to somehow think they're helping people by protecting their privacy when in fact you may be actually adding to their risk. And so again, I would just encourage people to take a common sense, practical approach to all of the hundreds of contact tracers that we have that are there. Whether you're a college student or whether you're someone who's recently attended a gathering, family gathering, or wedding gathering, if you can help identify people who may have been exposed, you may be helping save lives. It's probably the easiest thing you could ever have done in your life to help save someone else's life. And again, that is all protected health information. So there's the risk is in the case of Care-19 alert is essentially non-existent. In the case of getting contacted by a North Dakota contact tracer, it's beyond minimal that information could lead to anything negative or anybody, but the upside could literally be life-saving. So whether it's downloading a Care-19 diary, which uses the GPS technology to help you remember where you've been, or the Care-19 alert with its anonymous near-field notifications. Like I said, if you're a college student and you plan on going out to a bar, and 2 people in the bar, but there might have been 100 people there. If somebody else in that bar tested positive, and both of you are using Care-19 alert, you could get notified. No health, it wouldn't go through any health official organizations. It would be their phone to your phone. You're getting notified. And again, powerful tool. And again, the more people that adopt it, the more people that use it, the better chance we're going to have of helping us slow the spread. And I think, and particularly in areas where we've got people that are socializing with people that you don't know and don't know their names, or in large groups, this could be a fantastic tool. Next update is behavioral health. And before I kick into the talking to our topic today about the crisis of opioid addiction and overdose, I just do want to give a shout out today to North Dakota's First Lady. She was invited at the end of last week to join today in a panel discussion at the White House. The panel was led by First Lady Melania Trump and the drug czar Jim Carroll. Also on that was the Surgeon General Jerome Adams. Larry Kudlow, who works as an advisor to the president, also was a speaker. In addition to being an economic advisor, he shared today that he's 25 years in recovery. But one of the featured speakers today was the First Lady of North Dakota, and I would have to say, if you didn't get a chance to watch live, I'm sure it'll be out and up on the sites tonight. But as always, her courage to share her story and to fight for every single individual in North Dakota to be able to have an opportunity to live a life free of addiction and free of the shame and stigma associated with the disease of addiction, regardless of whatever path that's taking you down, whether it's brought you into the criminal justice system or turned your life upside down. With her lived experience and the depth of her empathy really was shining through today, as always. And again, a proud moment for North Dakota to have someone who at a national level is a face and voice for the power of recovery. So thank you to the First Lady again for another highly impactful presence today in helping solve this issue for the nation. And again, there's positive things happening here in North Dakota in terms of federal grants. And in North Dakota, we know that in 1979, drug-related deaths claimed 79 lives, and that was up from 66 in 2018. And last week, we're pleased to announce the Federal Substance Abuse and Mental Health Services Administration, or SAMHSA, awarded the Department of Human Services in North Dakota $4 million to reduce and prevent opioid abuse and overdose deaths. The state opioid response grant will address opioid crisis by increasing access to medication-assisted treatment, reducing unmet treatment need, and reducing opioid overdose-related deaths through the provision of prevention, treatment, and recovery activities for opioid use disorder. And again, with opioids, which are prescribed often, as painkillers and or prescription medicine, are highly, highly addictive. They cause a actual shift in your brain chemistry. This was not known at the time they became widely used decades ago, but certainly is understood now that these are highly addictive drugs. And once addicted, it's very very challenging to go through recovery. So this grant will support evidence-based prevention, treatment, and recovery support services to address the misuse, stimulant misuse disorders as well, which include those stimulants include cocaine and methamphetamine. Anyone taking an opioid can be at risk of overdose, and individuals at the highest risk are those that are taking more than one prescribed medication, people with a recent period of time where they've been off of opioids and again are in our back because it's easy to overdose coming back on, and individuals recently discharged from a treatment center for incarceration. For those that might be at risk of overdose, if you know someone who's at risk, you can save a life and identify the signs and have Narcan available. Narcan is a medication that could be administered when someone experiences an overdose. The behavioral health team has naloxone, or Narcan is a brand name, available for individuals at risk of overdose. And to request a free 2-dose Narcan kit, please fill out an order form at surveymonkey.com at r/ND Narcan, or call the behavioral health team at 701-328-8920. And I'm sure if you go to the behavioral health website, you'll be able to find that link for the SurveyMonkey. We want to remind people again during this time, challenging time, that North Dakota does have a law that protects individuals that seek help for someone else who's experienced an overdose, called the Good Samaritan Law. So if you're with someone who's overdosing and you're concerned about calling 911, go ahead and call. You'll be protected. You can save a life. And also, if you're someone who administers naloxone to help reverse an overdose, if you do that before the first responders get there, you're also protected from liability from trying to help save that life. And lastly, again, if you're struggling with addiction or know that help is available, there's many forms of effective treatment. You're not alone. Recovery is possible. And of course, you can call one of the many helplines or recovery talk lines that we have available. And again, you can find those at the North Dakota Behavioral Health website. On the good news is our next section. This relates to last week. We announced that Job Service North Dakota had submitted an application to FEMA for participation in the Lost Wages Assistance Program. And again, this was the Lost Wages Assistance Program was created by executive order by President Trump, and that's why the dollars are coming out of a FEMA, national FEMA bucket, which has got a limited amount of dollars. This is not coming through the traditional sources of unemployment dollars, nor is it coming from the coronavirus relief funds, which we've already, working in tandem with the legislature, have already put over $400 million back into our North Dakota Unemployment Insurance Fund to make sure that that was healthy and we could keep making payments to people whose jobs and lives were affected by closures during the pandemic. Yesterday, FEMA approved our application, making North Dakota one of the 41 states that's been approved so far to participate in the program. This grant funding allows Job Service North Dakota to provide an additional $300 per week to retroactively to North Dakotans unemployed as a result of COVID-19, and those payments apply to people who qualified, who had lost their jobs specifically due to COVID, which we estimated to be about 41% of those people who were on unemployment during those weeks. And so that's for the weeks ending August 1st, the weeks ending August 8th, and August 15th. Those are the 3 weeks. Job Service anticipates that we would have these payments would start going out by mid-September. The estimate is that approximately over 17,000 North Dakotans may qualify for this, and the expected payment to workers would be approximately $14.7 million. And so again, to be eligible for this program, you must have been unemployed specifically due to the pandemic, and they must have been previously receiving a weekly benefit amount of $100 or more. But we're grateful to FEMA for approving North Dakota's application, making these payments to North Dakota workers possible. We're grateful to President Trump for signing this executive order. And we're also, again, took a lot of input from the private sector, and the private sector, many people out there, again, we're talking a lot about unemployment, but on interacting with business leaders last week and this week, there are more than 10,000 jobs available in North Dakota for sure. More likely it's more than 20,000 jobs available in North Dakota. Many examples of people that were trying to hire during that time frame when the $600 a week of additional was being paid and people having difficulty. This program should not get in the way of any future hiring, whether that's today, tomorrow, or the next day, because these dollars will only be going out to people that were previously unemployed and qualified during those first 3 weeks in August. So in our quick gratitude section, I want to close with a quote, and this is from American physician and author, Dr. Lewis Thompson, and said, "Society evolves not by shouting each other down, but by the unique capacity of individual human beings to comprehend each other." And I think this speaks to the one of the ingredients that we could certainly use more of during this time of this pandemic, which is the empathy, which is having the curiosity and the energy to try to tap into that natural, unique capacity that each of us have as individuals to comprehend others who may find themselves in very different situations. So again, whether it's supporting people who are really struggling through this time, or acknowledging and respecting that some people may have loved ones around them or children that are at risk and they need to wear masks. Again, trying to dial up our empathy and dial down our judgment would be a wonderful thing to help improve our outcomes here in North Dakota and help us lead the happy lives which we all want to be able to pursue here in the United States. So with that, I want to say thank you to everybody who's been listening, and we'll be back here right now next Tuesday at 3:30. Until then, remember, be North Dakota smart and stay healthy by following those guidelines. And we'll now stand for questions. I'm going to go to Jeremy first, and then we're going to online second.
Governor, I'm wondering specifically on the decision to keep Cass County in the green designation. What was the thinking behind that?
Well, we talked about the three principles that and sort of guiding metrics, and one of those was high amount of testing. One of those was low positivity rate, and the other was number of actives per 10,000 people. And on those three metrics, I just want to say again, I think this is an example for the rest of the state. They didn't go to blue, which is low risk. They stayed at the new normal. They stayed at the green in the low risk area. So we'll continue to watch them. But right now, with the low positivity rate, high amount of testing, and while there is an absolute number of actives there, I think over 300, given the population in that county on a per capita basis, it's actually lower. There's less cases per capita in Cass County than there are in many of our other lower population counties. And again, it reflects the strong work, I think, of the COVID-19 task force there. And it may reflect a little bit again on, because of the work and the community spread, that there is, because even when we were comparing NDSU students compared to UND students, the level of positivity was substantially lower for NDSU students. So there's again situations just different in those two counties right now. But I think, again, over 100,000 of the tests that we've done in the state of North Dakota have happened in Cass County. So this has been well tested, and we feel confident. But if they start to climb up, then whether any county goes up or goes down depends on how well they're responding to the situation or the prevalence that they have in their community. So right now, that's why they left out. I would include Stutzman on that. Stutzman remain green. They've got over 100 cases. They've got a university, but again, they're for the same factors. They're in a little different situation where Barnes made it into the, which also has a university, Valley City State, moved up to the yellow, and Stutzman and Fargo and Stutzman and Cass on either side stayed green. But we take a look at that I-94 corridor this summer. A lot of out-of-state traffic comes through our state. More of it goes east to west than north to south, and so I think that's another risk factor for the communities along I-94. They just get more out-of-state traffic and more potentially transmissible moments. But we're looking at all that. But thank you, Jeremy. Going online.
Sydney Mook with the Grand Forks Herald. What does the bump up in risk levels mean for a university like UND?
It doesn't practically change anything for UND in the sense that we've got the North Dakota University System guidelines that were put in place, and again, we're at any point in time, any university president or the system can add controls that they see fit relative to their campus, whether it's mandatory mask wearing indoors, restriction on activities. Again, like local school districts, universities have a lot of flexibility. I think this just helps signal to the entire community up there. I want to signal a couple things. One is the mayor of Grand Forks is doing a great job, very engaged. He was on our panel with Dr. Burks last week, really on top of the numbers. So we really want to thank Mayor Paczynski for his work, and also the university and the task force up there. They had the highest percentage of testing of any of our universities. So they've been a leader in that regard, and they've also very proactive on providing spaces for isolation. So we did raise the level, for Grand Forks just based on the metrics that we were observing. We think that there's a lot of positive things, a lot of role model examples that are going on for other university communities to look at UND. And again, the numbers up there are very much tilted towards that 15 to 29 age group. We want to keep them there. And that's going to require, isolation and good choices by business leaders in the community, because we wouldn't want that level of spread to start moving into a vulnerable population. That would be very, very challenging. But so far, they're doing a fantastic job. Okay, I'm going to go Lane, and then back here, and then we'll come over here to Jacob and Tom.
So for these counties that are now in the yellow, is this more of like a designation? What really changes for them?
Well, under the guidelines that were created last spring, there are some recommended changes, really in many cases around density. So bars and restaurants, if you were in the green or the low risk level, it was 75% occupancy. When we're back up to yellow where we were last May, before May 29th, the recommendation is 50%. But again, as we say, these are guidelines that are helping provide kind of let me call it a forecast is maybe a way to think about this thing. When the Weather Service thinks that there's going to be a problem, they issue a watch. When they're more certain it's coming, then they issue a warning. And I would say that we've, in the case of, and then if you think there's going to be blue skies, you don't do any of those things. So the counties that are blue here, which is the lowest level, think of those as blue skies, we're basically saying, hey, you should always be on the alert because the weather in North Dakota can change rapidly, but the forecast looks good. If you're in a green, which there is risk, then you got to be really aware that you might be in a watch condition, which is, hey, there's, I wouldn't say thunderstorms and hail in the area, but hey, there's COVID in the area, and you got to be paying attention because these things could, take off quickly. When we move to yellow, that's kind of like, I think, from a weather standpoint, which is a warning, which is, hey, there's a lot of active cases per capita. Your testing percent positive is increasing. The trend line's going the wrong way. So we want to send a signal to the whole community, not necessarily that any businesses have to be start doing anything other than common sense we've been asking for before, but to just say, hey, look, we think there's a higher risk level. Let's be smart about the situations we're putting our customers or our families in. So I think that's one that people will zero in on. But at the end of the day, it's going to come down to local decision making. And when I say local, I mean it's going to come down to individual business owners. If I was a business owner in the hospitality business, because I've seen them, I've been around the state the last week. I've been in situations where we've seen people in bars and restaurants and in retail where the people working in those establishments are not masked up. If I was, even if I was young and thought I was invulnerable and I was going to be seeing 100 customers a day, and if you're in one of these counties that's yellow, the chance of one of those 100 people being a transmitter is quite high. And so, I think that you would probably say, hey, if I'm working in this establishment, I should be wearing a mask. If you're a customer going into one of these large crowd situations, whether it's retail or anything else, you might say, hey, if I got family members, I should probably wear a mask. So it's, again, it has to translate into a change of individual behavior. The map means nothing if it doesn't if people don't think differently. But I would say back on the weather example, I've seen this all the way back to growing up in Arthur. I mean, if you said, hey, we think there's an extreme weather watch, some of the farmers would batten down every hatch and they'd strap everything down and they'd move vehicles inside so that if they had a place to move them so they wouldn't get hailed on. And other people would, take one look at the sky and go, I don't think it's going to hail. And then they let it roll. People have different risk profiles of what they're going to do. And then, if it turns out to be a hailstorm in a localized way and somebody took the precautions, they look pretty smart. If it doesn't hail, what are they out? They're out a little bit of precautionary effort and really, when asking someone to, wear a mask or stay socially distant really doesn't on that individual doesn't create any additional cost to them any more than it costs a farmer to move his combine in a shed if he thinks a hailstorm's coming. So I think again, this is just pragmatic common sense, and we're again sort of indicating based on increasing positivity, a high amount of testing, and the number of cases per capita that the places that we have on that yellower map. If you're traveling to one of those this weekend to shop, I'd take a little more caution. If you said, hey, I don't need to wear a mask, I live in a county that's blue. If you're going to live in a blue county and you're going to shop in a yellow county, bring a mask with you and then don't bring the COVID home. So we think it'll help people make individual choices. That's our goal as much as anything. And like we say, our goal is keep our schools open with on-premise learning, keep all of our businesses open. We do not want to end up like they had to. You get north of 10%, and then you start putting pressure on all kinds of things that are health related, and that's when the other states, when they got into double digits, they had to start closing down bars and other events. We don't want to do that in North Dakota, so we're just at that 5% moving the wrong direction. We can sort of, I would say, nip things in the bud right here and maybe not have the fate of other states. So this is next 2 weeks matter, and North Dakota has a chance to step up and do things to help their community and pay attention to the sort of the weather forecast, the COVID weather forecast, if we will, we just put out there. Take it seriously because we've seen these trends in other states and where they led to, and it's not a place that we want to go. Sir?
WDAY. Question about NDSU. What is the positivity rate there? President Bershani didn't know that yesterday. And then the follow-up to that is they had mass testing events Tuesday and Wednesday, 1,500 tests each day. They used less than half of them each day. Is there a concern that there could be COVID going around the Fargo area and it's not being detected because there isn't a high turnout for the mass testing events there on campus?
Matt, good to have you here, and you had multiple questions in there. The first one I'm going to defer on because I would defer to our fabulous website with all the data. I don't know that we're releasing data publicly about UND versus NDSU. I think it's all just captured in there. If I'm wrong on that, someone can let me know, but I think it's just reflected in the county. So I think if you said, hey, look at Grand Forks County's positivity rate and Cass County's positivity rate, I think Grand Forks is more than double that of Cass County. I think that reflects what we're seeing at the university level, because again, the institutions reflect the communities. In terms of the ample testing that we provided, the 1,500 and 750 showed up, that still is a lot of tests. I mean, remember, last spring, there were some days we weren't doing 750 tests statewide. If we're doing 750 tests on a single campus, we're getting a strong surveillance look at what the prevalence of that is. So I feel confident that we're doing enough testing, certainly doing enough testing in Cass County to have a good, strong sense of the level and the presence of the disease in that community. I think was I going Jacob and then Tom?
Governor, these trend lines aren't really anything new. For the past few weeks, you've talked about how the data isn't necessarily going the way you want it to. Do you find yourself preaching to the choir? And what happens if things don't improve over the next few weeks?
Well, I think to the degree that trying to get a broader message out, that's definitely something we need to do. I mean, we know that. I've got a deep amount of gratitude for every single person that watches these every day, hangs in here, listens to all the questions through the end of these things. A deep gratitude to them. That's not the 15 to 24-year-olds. not the target audience for this program every day. And so again, when we talk about trying to reach university students, we got to have different approaches and different communications. So as we broaden out some of our communication strategies, get more of the student leaders involved, we know that we have to reach new audiences to get higher compliance. It's pretty easy from here to reach the business community because they can be affected by it. And again, we're probably doing a good job of reaching those that are most vulnerable, just based on the age and demographics of people that tune into television or pay close attention. But really reaching that younger demographic who may be asymptomatic, I think that's a challenge in every state. Certainly something that we're battling here. And to your second part of your question, if this appeal to greater awareness, higher personal responsibility, and more compliance, which is really what we're appealing to with our COVID weather forecast here of that, our heading in the wrong direction in some of the counties, heading in the right direction in some of the counties. Both directions, we got this two different things that we're messaging here today. But again, where we would have to, as you just take a look at other states, when they've got back up into double-digit positivity rates, that's when they've had to go back to business closures, particularly those that have got high amounts of transmission. And that's something we would like to not have to do here in North Dakota. So particularly if you've got a business that's got a potential for a high degree of transmission, if you want to protect your jobs, protect your business, protect your bottom line, please, help us be smart. Make sure that your staff's got an opportunity to wear masks, take advantage of getting people outdoors on this weekend, and think about your business model in ways that you can to help, help manage the spread of this, and, serve your customers and your team and your community. And again, when they're doing that, they're also helping keep our schools open. This is a thing which I want to keep reiterate. When we can get it down in a community, that's a way that we can, if we reduce it in a community, we have a better chance of protecting our teachers and protecting all of our K-12 students and keeping them going. So, which is what we got to keep the schools going so that parents can resume their lives, which we have many parents that both work in North Dakota. And again, the challenges of trying to manage on a hybrid school and manage childcare and manage your work, we're asking a lot of parents right now in these hybrid models, and that's a big ask. And again, if the data is, as the White House is starting to show, if the data shows that it's better to keep kids in school in their cohorts 5 days a week, then we should be thinking about doing that and taking a big pressure off the parents. We're not talking about a few number of people. 120,000 school kids, there's many of our kids have come from two-parent families. Some of them don't have two-parent families. Call it 1.5. That means there's 180,000 parents out there at a minimum that every day are maybe dealing with these challenges in the school schedule. So again, if you say, hey, this doesn't affect me, I'm not going to get sick from COVID, you may not get sick from COVID, but your actions may be affecting, the 100,000 plus vulnerable, or the 180,000 parents that are, or the 120,000 K-12 kids. There's actions and reactions here, and nobody in a pandemic, their actions don't operate separate from all other individuals. When we say we're in it together, it's not a slogan. When you got a pandemic that can only be transferred from human to human contact, we're all in it together, and so everybody's actions matter. So that's what we're looking for. Okay, Tom, and then Dave, and then we'll go back online. Jack, am I missing you? Have you had your hand up? Okay, I was confused because you're not on the other side, but it's fun. Glad you're here. Okay, who's next? Tom, and then Dave.
Governor, I'd like you to drill down a little bit on Williams County, because it has been a tough couple of days in Williams County. Yesterday, the courthouse reported that they had a case there. A trial actually got stopped right in the middle of the trial and suspended for 2 weeks. A car dealership was closed down yesterday temporarily because it had COVID. And just this morning, 3 different schools report that they have positive tests for COVID. So it's safe to say that the families in Williams County are really nervous right now via the news that they've gotten the last 48 hours. Can you talk to those families who are sitting around the kitchen table as they get ready to go to sleep tonight? How should they feel? What message does the governor have for those families in Williams County?
Well, I think the messages for those families is the same as messages from all over the state, which is Williams County, which was one of the counties that we moved up today to yellow, to moderate risk, back where we were last May, was based on the fact that we saw increasing positivities. The examples that you're sharing reflects that, and whether it's a school or the college or a business, they're all reflections of the community. Everything I just said, we're all in it together. I think for the K-12, we knew that when we put 120,000 kids back, we're going to find positives. The good news, this is, people say it's just like the flu. The good news, this is not like the flu if you're under 18. This is less deadly than the flu if you're under 18. So if somebody is under 18 and tests positive for COVID, we want to isolate them. We want to make sure they can do distance learning, but we want to keep those schools going for the health and benefit of anybody else. So again, I would encourage the school districts there and across the state to not be discouraged by finding a few positives. We knew that would happen. I want to thank everybody up there that's involved in public health, because they're finding the positives and getting them isolated. I want to thank if a business was proactive and shut down for a few days, or the county courthouse taking actions. Those are the kind of quick, local, targeted responses that allow us to keep our schools open and keep our businesses flourishing. So sounds to me like Grand Forks, Williston's taking a lot of smart actions. This is keep the state open, take the targeted action where you find the cases, and then everybody else keeps moving forward, and we move forward with an understanding that we're all in it together. Dave?
The early morning task force has been doing a lot of discussion about how you reach the younger crowd. They would like to do messaging that's specifically for them. You also referenced messaging that might be different. Is this something the state might be looking at, doing some messaging for those between 15 and 24?
Yes, we're absolutely, and again, we have reserved some of the coronavirus relief fund dollars towards communication plans, and I know that things are underway to be looking at how do you what's the platform and what's the message that actually reaches them. And of course, for younger folks that aren't watching the evening news, it's going to have to be social platforms, and it's going to have to be the right messaging. But again, we know on social that there's the amount of misinformation vastly exceeds the amount of actual information that's out there on just about any topic, not just the pandemic. And again, one of the things that we're going to have to make sure that we're helping all of our next generation of students that there's a time for if somebody is 65 or 70 years old in North Dakota, and they grew up when there was 3 channels, ABC, NBC, and CBS, and maybe there was a PBS on Channel 13 in the Red River Valley, but you had 4, 6, and 11, and on the evening news, those evening newscasters, the Walter Cronkites and the Tom Brokaws were among the most trusted people in America. I mean, high degree of trust. That's not the case today when you take a look at almost any source of information. So when you have a low trust environment and people are quick to grab onto any pieces of information, the communication challenges are very, very different. Before, in the old, 30 years ago, 40 years ago, if this happened 40 years ago, you do a public service announcement, you put it on all 3 networks, everybody complies, away you go. Now it's, you've got, giant divides in our country about and whatever new advancement comes through in terms of something that might help solve, like convalescent plasma, remdesivir. I mean, for every article that says that this is something that really works and the medical community tells you it works, there's 10 articles that says it doesn't. So I would just say the operating environment that state of North Dakota, that any governor's operating in, is more complex than ever before. It's not just emergency management, it's emergency management and crisis management in a time frame when you're battling both the pandemic and you're battling the misinformation. And it's really no different than some of the other challenges. When we took office, we had DAPL, and there was an on-the-ground challenge, there was a legal challenge, and then there was an information challenge. And so you've got these multi-front battles that you're fighting. And certainly with this one, it is almost as big as the pandemic is the misinformation. I mean, as a country, we'd be further ahead with less misinformation. Okay, I'm going Danny and then back to Matt.
Mike Smith, 660 KYZ Williston. Will moving counties to yellow affect high school sports?
Answer to that is no, because high school sports were not under the North Dakota Smart Restart guidelines. That was all handled under the North Dakota high school activities. But again, someone that's got if you got a county with almost no cases, you might choose to have with appropriate social distancing and appropriate controls, you may say, hey, we can have more people at this game. It's outdoors, a fall football game, a girls cross country, whatever it is, you might decide to do that. If you're in one of the yellow counties, you might say, hey, let's take a look at what we have, because we want to be, helping control the spread as opposed to creating we don't want to be creating more transmissible moments. We want to reduce them. But I think we do owe it, we do owe it to our high school kid. I mean, if high school kids are saying, hey, how come I only got, only my parents can sit in the stand at the football game, but there's 4,000 people at the Speedway, then the local and city and county officials probably should all get together and say, let's get on the same page for how we think about these events and make sure we're being smart about the spread, but also being fair to the students that we want to keep in school. Matt, and then I think we're going, is it Matt, and then back to Jeremy?
You mentioned, some of the national reports that actually put North Dakota in the red, and you explained, your logic and your interpretation of them. But you would think with increased testing, the positivity rate would actually hopefully go down. But with increased testing, we've seen our positivity rate go up, and that doesn't lie. I mean, what's your answer to that? I mean, some of those reports are going off our positivity rate and feel we should be in the red.
Well, let me just take two elements of that, because there's multiple questions there. I think that if you take a look at there's many different independent organizations have got their idea of how they want to rate the states. I think the CDC and the White House are ones that are sort of a coalescing around that, which is if you're 5% or below on a rolling 14, you're green, and if you're calculating the way we are here in North Dakota, the way the CDC recommends, a state that's in the green, like North Dakota, to 4.9 rolling 14 day. I'll bet going the wrong way, but we're in that thing. We should be, have no travel restrictions around the country, and we're a green state, particularly if we're doing a high degree of testing. Because if you're doing a high degree of testing like we are, very high degree of testing, and you've got the low positivity, then that's a good thing. If you're between 5 and 10, then we might be considered a yellow state, and if you're above 10, then you're in the red, and that's really the way the White House is looking at it in their guidelines. You're hypothesizing that if you did more testing, then it should lower your positivity rate. Well, that would be true if you were trying to test in places where you knew there was no if you knew there was no COVID. I mean, if we were, doing drive-in testing in the 20 counties that haven't even hardly had any cases, we could drive down. But where are we doing our testing? We're doing our testing on college campuses. We're doing our testing in all, not just skilled nursing. Some states weren't even getting it done in skilled nursing. We're doing skilled nursing, and we're doing assisted living, and we're doing basic care. So we're doing all levels of congregate living. We're doing it in our prisons. We're doing it in our jails. We're doing it in all the places where people have had outbreaks. And so we have been, from the beginning, hunting for positive cases so that we can isolate them. And so I feel like that, again, when we got such big disparities on the amount of testing that are going on, and some testing strategies that may, in fact, be people trying to get an artificially low number, we've never been about that. We've been about the way we protect the people in North Dakota is you take something that's invisible, you make it visible. You do that by finding the positives, and then we can actually have actionable data. When we have a positive case, we have actionable data. We can have someone isolate. We can find out who was close to them, have them quarantine. We can take action. The idea that you don't want to know where your positives are, that's a good thing. I mean, then that would literally be like saying, okay, I want to drive this car with my windshield painted black. I mean, that would be what it'd be like to me. And I'm just like, why would we, when we have the tools and the ability and the capability to do that, why would we want to do that? And I think, again, when we saw this announcement last week about the Abbott $5 rapid test, complete game changer. I mean, it'll be a complete game changer for the country. Now, those will get all absorbed in the next 3 months. I think the federal government bought the first 150 million tests at $5 a piece. But I would say, again, whether you want to, see whether it's a Bison football game or a Garth Brooks concert or whatever it is. I mean, if your ticket was going to cost $40, someone might say, I'll pay $5 more to know that everybody else in the stadium all tested, negative today. Right. I mean, that, the collective good from that. And that's a real possibility for whether it's I was, speaking with the ambassador to Japan this morning, or ambassador to the United States from Japan about some trade issues. And, of course, they had to cancel the Olympics this summer in Japan. That's you prepare for 12 years and then you have to cancel. They'd like to hold them next summer. Well, I think that was in doubt. But if you think there's going to be multiple competitors delivering $5 tests with high accuracy, there will be an Olympics next summer in Japan, is my prediction. But it'll be because of that, because of the widespread testing. Okay, Jeremy, and then Tom.
Governor, I'm wondering how dynamic these changes in risk level by county are. Is this something we can expect to see changing every day, every week, every month? I guess how often would those be adjusted?
Weekly is the expectation I'd like to set. And I would say, when I say weekly, it doesn't mean they're going to change every week. It means that we're going to be, reviewing them daily and either in front of or before we have the press conferences here, so we don't have to maybe spend as much time. We might release them ahead of the press conference so people can absorb the data, and then we can talk about them here. But it was I think weekly is the right pace. We've tried to get a sense looking backward in the data on how much a few days might change people, because there are, bubble cases where people are on the edge, and there is some sensitivity on the low end of moving from blue to green, based on data. So I think smoothing it out a week at a time is probably better, and it gives businesses and others better planning horizons. So we'll take a look at it on a weekly basis.
Follow-up, will these new criteria be published somewhere on the website?
Yeah, absolutely. Absolutely. Tom?
Well, Governor, a couple of days ago, the Department of Transportation had a open public meeting on Zoom, and I know that was made possible by your executive order. The question for you is that in this public meeting, rather than having a live meeting, they had a tape-recorded meeting so that people were not able to interact with them even though it was on Zoom. My question to you is, does that defeat the purpose of an open public meeting? And did you envision us having Zoom meetings that were tape-recorded as opposed to live, substituting for public meetings?
Tom, I have to say I'm not familiar at all with this one, and so I won't speculate on it. But in response, I mean, a taped presentation is not a live meeting, so I don't know how that would qualify. But I'm going to have to get into that, because that was never in my mind that we would somehow have a tape meeting try to pass as a public meeting. There has been a lot of public input, whether it's been Fish and Game or other folks that have had great interaction online with virtual meetings. In some cases, we've had higher attendance and more input. So I think we see the potential there. But this one, I'll have to grab you offline and see that, because I don't that wouldn't qualify for if it's meant to get input. What's that?
Doesn't meet the smell test for you?
Well, I mean, it doesn't make sense to me, so I would have to understand what they were actually trying to do with that, because we need to do, there are times when we have to get information out, sure, do a video and broadcast it and widecast it to a lot of people, but a public input meeting has to include public input, and we've had a number of those successful meetings already this year. Like I said, with the regional game and fish meetings, we had more people attending because more people were able to attend, versus hey, you got to be in this physical location, drive for an hour and a half, got to be there at 7 o'clock at night. I mean, people were able to dial in from home if they couldn't get a babysitter, for example. So I like when we can get broader input is what we want to try to get.
Governor, this was a meeting that was set to discuss a truck bypass highway, a road, and it affected a lot of families out there in Williams County who were looking forward to talking, and then when they weren't, they called us and said, well, how does this work? And it was our feeling that you would want to know at least that this thing is coming up. Maybe it happens in other areas, and give some guidance to them. They did say, by the way, to be fair, that they could email their questions, but nothing live.
Okay, well, we'll appreciate you giving us a heads up on that. We'll check into that because we definitely want their input. Going Lane and then online.
In reference to your executive order on the substitute teachers, it was just brought up to me that it's a big incentive for substitute teachers after those 10 days to keep teaching to get that increase in pay. And now there might be a worry that without that incentive, substitutes might hit that 10 days and not want to teach anymore. Is there any fear in your mind that that's going to happen and schools might have to close down anyway from lack of teachers?
Well, if there's a perverse or negative incentive around pay related to that executive order, we'll have to run that one to the ground because we're trying to increase the supply of potential teachers to keep schools open, not decrease it. So if there's something perverse about it, we'll be all over the top of that. But we'll work with and again, those contracts, there may be some elements that are statewide, but a lot of teacher contracts are district by district. So we'll have to dig into that one. So we're on that one. Our team on both these last two, make sure you take an action item so we can dig in. Danny?
Scott Hennon, WZFG KFYR Radio. With today's news for 8 counties, the pain and uncertainty is increasing for North Dakota businesses. What is your estimate of how many North Dakota businesses, especially in the hospitality industry, will survive COVID? And are you in favor of additional aid for those businesses?
Okay, multiple questions there. And first on the sort of the supposition that there's additional pain. The real pain for these businesses is if we end up in double digits and we have to start doing mandates and closing people down. That would be, right now these are guidelines and businesses can figure out a way to, try to manage their business, grow their business, navigate their business through this time the best way they possibly can. In terms of, what estimate do I think the percentage of businesses, if we take a look at pre-COVID in any given year, across America, and I also believe it holds true for North Dakota, the most likely form of a new business is for someone to start a restaurant, and the most likely sort of lack of success rate or death rate for businesses are restaurants. So restaurants have among the highest turnover in any case. It's been particularly challenging. Wow, I mean, if you were someone that opened a restaurant in January and you hadn't built up your clientele, hadn't built up your customers, this would be a tough time to do that. So I think that we're going to see when we look at the data nationally and with North Dakota that the restaurant business has had some real winners and losers in terms of some people that found a way to thrive with takeout or drive-through and others that weren't able to do that. The other aspect on hospitality, of course, is hotels and motels, which in North Dakota has been a very strong business because of our strong economy and because of the net influx of people moving to North Dakota. Business travelers to North Dakota, that's been a very strong business. Right now, hospitality, the business has probably been the one that has had the most economic challenges of any segment nationwide and possibly in North Dakota. I know that the Bank of North Dakota is working on repurposing some of the dollars that they received earlier. I know that they're in negotiations with people from the leaders from the legislature, and I think that some of those discussions may lead to whether or not there's additional targeted relief coming through Bank of North Dakota programs, particularly for hospitality and maybe particularly for the hotel business. Because that is, like I said, a business. When you take a look at airline boardings in our state and the amount of transportation, I mean, obviously the airline business is another one that's been really, really curtailed. We don't have any airline businesses that are headquartered in North Dakota, but we're on the last stop on a lot of these flight programs here, but so I know that the airlines are really suffering. The airlines did get a lot of support federally initially. They would all tell you not enough, but I think we have to take a hard look at hospitality. But of course, when Scott's asking, what's your projection? I mean, we're doing everything we can to try to keep every business open. We've tried to be among the least restrictive states, and today by being proactive and keeping us out of that zone, trying to move quickly now before before we get even wider spread, before we get into that double-digit positivity rate. If we can do that, this is actually, to me, as I said, this is our path towards freedom, and it's the path towards keeping businesses open. It's not a restriction. In that sense, this is the way we win that battle. Matt?
Targeting positive tests. Any idea when that number then may start coming down if you're specifically trying to target positive testing?
Well, the number, how fast the number comes down really depends a lot on whether or not we've got compliance on the North Dakota SMART guidelines. I mean, distancing and keeping to smaller groups and wearing masks. If we have higher compliance, as soon as the state has higher compliance, then the rate of transmission goes down. The other thing that we'd help see the numbers going down is those folks, the over 2,300 people that we have today that are positive and their close contacts, that if the people that were all positive all participated with a open mind and open heart towards saying, look, I want to keep businesses open, I want to keep schools open, I want to help protect family members, I want to protect my friends, I want to protect my fellow college students. If they all participate in contact tracing in a robust way, then we can figure out who are the close contacts, and we can either get those people tested or we can get them isolated, and we can help shut this thing down. But if we've got this many positives, and you start having people that aren't highly compliant with contact tracing or isolation or quarantine, then we're going to continue to see the spread. And from the mathematical standpoint, I mean, we haven't talked a lot about it here, but talk to any epidemiologist. It's the R naught or the R little teeny zero, but it's that replication rate. And if one person is passing it to more than one, then we're going to see the numbers grow. If one person is passing it to less than one, we're going to see the numbers shrink. And in some of these areas that we've listed as yellow today, at the rate the cases have gone up, the presumption has to be that we've got single individuals are passing it to multiple individuals, probably doing that because they were asymptomatic and they were in social situation with large groups with people out wearing masks. That happens. May not be happening on the campus, but it may be happening when they leave campus and go to a function or a party or an establishment off campus, is one of those places where we know that those transmissions are occurring. So we have to again just invite people to bring their best self forward in this fight, and that includes doing what all of you are doing and people are watching are doing, which is again is being following the North Dakota SMART guidelines.
One quick follow-up there. You moved like Grand Forks County to the yellow. How long is that in effect, and what do you need to see to take it out of the yellow?
Well, as I answered the question earlier from Jeremy, is we'll be reviewing those weekly, and what we would need to see is continued high amounts of testing. We'd need to see active cases dropping, and we need to see percent positivity dropping. Pretty simple. One last question. Okay, we're going online for the last one.
Renee Jean with the Williston Herald. We're hearing some reports of cases of COVID in Williams County schools. Are the numbers of cases in schools being tracked? And if so, do you know what that picture looks like at other schools? And at what point would these cases lead to closures?
Well, I'll work my way back for Jean. There are a number of questions in there. Closures is going to depend on local school districts working with local public health. We would have encouraged, again, doing everything you can to keep schools open. If you've got, an individual that tests positive, identify that, student or staff or faculty member, that teacher, and get them in a situation where they're being isolated, and get the people that were close contacts, get them quarantined. If you have to take a whole class out, we said take out an individual before you take a class, an individual plus close contacts, take out a class before you take out a building, take out a building before you take out a school district, because again, we're part of if we're doing good cohorting in some of these larger districts, we can, like I think here in Bismarck, there's 17 plus buildings. I mean, I hope we never get to the point where the whole school district is shut down, but you might have classrooms, you might have buildings, depending on that. But if you're doing the appropriate amount of testing and people are following the guidelines of local public health, we want to just keep managing our way through this. As far as the data, the question there is, again, I know that there's some questions, which we always have, regardless of the amount of data that we're releasing. We're trying to find this path between protecting personal health information, the Health Information Privacy Act, HIPAA. We run into other additional privacy challenges when the people's health information are under the age of 18. So there's intersecting federal laws relating to that. And so I would just have to say to those that are asking those questions is that we are pushing from our administration to release all the information we can to the public that we can legally release. I mean, that's the edge we're pushing up against. We want to be as transparent as possible, and I think, again, it was really fun. I mean, again, not that it's fun to be in a pandemic, but I'd say rewarding is the right word. Rewarding last week to hear Dr. Birx, who her and her team look at all 50 states' websites for information, and her comments right out of the box were North Dakota's got one of the best. It's easy to navigate. The information is actionable. It's at the county level. It shows progression. It's got addition and not just addition. We're not just showing charts of cumulative, which, by the way, will only go up. If you add a number to a number, it can only go up. That's an interesting math thing. But if you have where we're tracking actives, we're tracking the percentages, we're normalizing by population. So fun to hear her talk about it being the best in the country. But with that, we know we can always get better. So when we hear these requests for additional information at the school level, we hear you right now. That information is not going out the door, but we're trying to figure out. Each school district has got a designated individual within the school district who signed a non-disclosure and has gone through HIPAA training. And so we're doing everything we can to facilitate the transfer of information from local public health to the school district, so the school district isn't flying blind, but there's still, I think we've got some legal hurdles or legal concerns about releasing all of that information to the public. Again, particularly if the numerator gets too small, if you're in a very small school district with small populations, that could be a challenge. But we'll keep pushing from our end. Thanks for the question. Thanks for everybody being here. Lots to cover today, and thank you all for being here.